Hi, my name's John Pasternak. I'm a family physician in Medicine Hat, Alberta. I've been living with ATTR cardiomyopathy of the wild type for the past 3 years. So I was diagnosed in around age 62 with amyloidosis. The interesting thing that finally brought this all to a head was I love golfing and go away every year with a bunch of doctors on golf trips. After 3 days of 36 holes a day, I suddenly realized my legs were like stovepipes. My belly was out to here. I could hardly walk 20 feet. And after an echocardiogram, which showed an ejection fraction of 40%, this cardiologist had me do a cardiac MRI and a pyrophosphate nuclear scan, which he suspected right from the start was going to confirm that I had transthyretin amyloidosis. And he told me that it was a progressive, ultimately fatal condition, that I might have 5 years to live, and that I might need a heart or liver transplant to save my life. And like any patient who's told a bad diagnosis, the feeling is, why me? It was pretty hard on everybody in the family. My kids were first, of course, very shocked that their dad has a really strange heart condition, and also with the specter that it could be genetic. They were extremely reassured when my genetics came back to prove it was wild type, so that they knew that they weren't facing a difficult time down the road themselves. And of course, my wife, we've been very close for 40 years, and she's never imagined what it would be like, to lose me. Primarily, it's reduced my exercise tolerance. I find I really struggle to climb hills. I struggle if my blood pressure is higher, so I have to avoid salt. I have to check my blood pressure regularly. I continue to play golf, but I have to take a power cart. Since I've been doing reasonably well, Dr. Fine has encouraged me to try and get back into shape because it's safe to do. I'm now encouraged that I can actually start getting back in shape. I started working less and less, mostly in the operating room, which I love. I love to assist at surgery, so that became my plan. And like anyone else, I guess you start to figure out a bucket list of things you've probably not yet done in life, but always planned that you were going to see all of our children in their careers and where they are as often as possible, and just spend time with each other. I mean, as a family doctor, you realize in retrospect that you spent a heck of a lot of time at work, and when given this chance now to try and make amends, maybe spend more time at home, that's been a very good thing too. If there is hope for the future of drugs that can slow the process down, then the earlier the diagnosis, the better.